How do we lead advanced care planning teams in the dialysis unit as a social worker is a really important question as we embark upon this work. So how do we communicate with different professionals who have different values, training, ethics, etc., is really important to this work. There's some interesting research out there about social work involvement in advanced care planning. So we know that social work involvement in advanced care planning increases patient discussion with providers. So that means that when we talk to patients about advanced directives, they're more likely to then talk to their doctors or PAs or nurse practitioners about advanced directives. In a study with patients, Wong and colleagues found that 34.6% of patients said they would like to discuss advanced directives with their social worker, whereas 36.8% said they would like to have that discussion with their family doctor. So social workers were right there neck and neck beside the family doctor with having that conversation. But up to 90% of social workers reported being involved in advanced care planning discussions with patients and felt confident about their ability to have conversations, which is in part why we're doing this project, because we know that social workers are trained in having difficult conversations with skill. How do we advocate for social work skills within our teams? So just bring up three things that I often go back to when I'm advocating for social work services in a medical team. I think one of the challenges is that oftentimes we as social workers get our orders from a physician, which makes sense in a medical model and sometimes sort of sets us up to maybe other people assume they know the unique skill set that we bring to the table. And so I think, part of our ethical guideline that's outlined in NASW Code of Ethics is that it is our ethical obligation to educate others about what it is that we do and the skills that we bring. And so we can't assume that people know or understand that. And so being able to communicate with the team, like if you're having a problem in this part of the conversation, like, have you considered this strategy, or this strategy? Because these are the things that I learned in my own training. And so, I often will remind my colleagues about how social workers are trained in therapeutic techniques. The Council on Social Work Education that has hopefully accredited all the schools that we've been to requires us to have training in engagement, assessment, intervention, and evaluation skills with patients or with people, individuals, with family members, even with organizations and communities. We also are trained in human behavior theory. And so the way in which we look at how problems exist with regard to barriers to advanced care planning, et cetera, or barriers to having conversations about death and dying is viewed through that lens. So, to me, that often means I'm thinking about, systems perspective. I'm thinking about resiliency. Sometimes I'm even thinking about existential work, but that is all driven by the theoretical background that I'm trained in, which just means that I'm going to approach the situation differently. And the other piece is, I think, reminding folks about the Subpart U regulations and the role of the social worker. The federal legislation was written for a social worker to be able to offer that unique systems approach and skill set. And so when we do this work in teams about talking about advanced care planning, it's important that we can draw on what our unique offering is in this work while honoring the unique offering of our other team members that bring that technical medical knowledge as well.